Here's everything you need to know about how to treat type 3 vertigo and Meniere's disease. I appreciate you commenting, so please ask any follow-up questions because we're going to go fast. I'm going to hit you with a lot of information. Let's do a quick overview of the three main types. One is the digestion dominant, about a lot of phlegm and digestive issues. Type 2 is inflammation, allergies, autoimmune dominant presentation. And then type 3 is a pain, muscle stagnation, musculoskeletal dominant presentation. Okay, so how do we evaluate it? So an area of interest is the C1 and the atlas. So what you can do is you kind of find your under your ear hole, you'll find this bone, you'll palpate to the tip of the bone, and then you'll palpate down. And if you feel on both sides, this is your transverse process of C1. And what you're looking for is just asymmetrical, whatever. More bump on one side, more pain on one side, but this area should be exceptionally tender. So if this feels off, now we have something that we can work with. And if we can get this to feel better, then you will see a decrease in symptoms. So the muscles that attach to C1, there's front ones, there's side ones, and then there's back ones down here and up through here. So there can be a combination, but definitely you'll find one that's more tender than the others, and we start there. So the front ones that we're looking at is the longus colli, which is a muscle that you can't palpate it. You can't palpate the C1, but you can kind of palpate lower down. So if there's a lot of tenderness through here, you also have the middle scalene. So we have in front of the SCM, which is longus colli, and then right behind the SCM is the middle scalene. So those two muscles attach to C1. So we got to release those muscles on whatever side, even if it's the opposite side, whatever feels most tight or tender, we got to treat those muscles. Okay, so then we come to the side of the neck. The main one is levator scapula, which attaches to the tip of the shoulder and then traces up and attaches to the side of the neck. People often feel this tenderness in the shoulder and kind of as they stretch the neck. The last two are splenius cervicus, which it starts down here and then it comes and attaches to the side, and then your occipital muscles through here. There's a bunch of little ones. Assess those muscles, we find what are the most tender areas, and we treat them. Oftentimes you'll get a couple areas. So the back on this side, we'll kind of balance the front on this side. So it doesn't matter the side, all you're doing is treating the tight muscles. So what are some therapy options? From the most conservative to the least conservative, things that you do yourself are going to be safe. So massage and stretching. And then you can have someone else massage you. Go to a massage therapist. You can get acupuncture done. You can do chiropractic. If you've never had experience with chiropractic, I definitely would save that for the end because that definitely can trigger vertigo attacks. Again, with the self-massage and with the acupuncture, you want to start gentle and work into stronger treatments because stronger treatments can trigger the vertigo attacks, but that's kind of a good thing because it means that we're treating the right areas. When you're stretching the area, don't just focus on the neck, but focus on the opposite part, the lower part of the spine. Relieving tension of the lower back will help relieve tension in the neck, specifically with atlas sort of stuff. I also would recommend gua sha on the neck. You can use press tacks as well at some of those tender spots. For the stress-induced vertigo, I would recommend breathing exercises and some owie patches. There are a bunch of other things. I have some videos you can check in my profile. You can also look at my website. I have a lot of detailed explanations of those techniques as well. Again, I appreciate the questions. I appreciate you interacting. If you have any more questions or comments, please comment and I'll get to them when I have a chance. Thanks.